We are happy to have Carter Andrews on the podcast today, who is one of my amazing patients.
Very happy to be here and very happy to share my story. I think even just in the time since I've had my surgery, I've had the opportunity to inspire a lot of people and talk to people about my surgery, and I'm happy to share it.
Yeah, and I think the big thing with your story is everyone says, like, God, she looks young. And this is a very massive misconception that facelifts are for people who've gotten old and look tired and wrinkled and sagging. That's not the case. And we're going to go through how you came to this choice and how you went ahead and did it and what's going on for you. So thank you again.
Yeah.
What triggered the kind of going down the pathway of like, I think I need to have a facelift? Like, how did you come to that?
I guess I initially just felt like I would wake up and want to feel my most confident self, but then feel tired looking, no matter how much sleep I got, no matter how much I exercised, no matter how much green juice and spirulina I drank. Like, I would wake up every day and I'd be like, why am I so tired?
Hang on a second.
Hold on. Wait.
Now, I've heard from a lot of celebrities that that's how they look great. They just drink a lot of green juice,
alkaline water,
That's right,
sleep.
and they just look amazing.
You can only do so much of that, and then it just still doesn't fix in my opinion, the elasticity in your skin or your genetics.
Shocking.
I tried everything. Like, I did fillers in my face. Like, I've done, I did threads like a very long time ago, completely regretted it. It was very expensive, and it worked for a very short period of time, and it felt weird.
Did you like the way it looked when they did the procedure?
Initially, yes.
Correct.
I loved it because it pulled my face back.
Right.
For how long? How long did you notice that?
I would say it probably lasted for like 3 months when they say it's supposed to last about a year.
Right.
But I loved the look of it. And my main concern was my jowls, like sagging on the side of my face, and then also like my eyes. And that's where I got the threads. And so initially it fixed it, but it's not a lasting procedure, and it's costly, and it can be kind of dangerous. And it starts to eventually change your face, and you look weird, and you don't look natural. And I love the natural look. And so eventually that's kind of where I got to start exploring surgical procedures. It initially started with like wanting to get like a lip lift and then wanting to fix my lower face. Then I saw online that the upper blep on your eyes was really popular. And then I started looking into that. And then the process kind of started from there. So I had talked to actually like a few other doctors before, and being younger, more than is common, but becoming more common to get a facelift. I'm 30
in the room. Yeah. How old are you?
So I'm 37.
Okay.
I will be 38 this year in August. Being younger, I had talked to some other surgeons, and I didn't look, I would say, like bad in person. I just felt like I looked tired, and I wanted to look the best, most confident version of myself that I felt inside. And so I had talked to other surgeons, and some of them were like, you're not drastic enough. You don't need this. People would say to me in person, like, you look fine. And then, I take a picture and I'm like, oh, okay, like, I don't love the way that I look. And then, at Dr. Calvert, I had seen you and I had met with you, and then you immediately addressed all my concerns when one person had said, oh, you just need this like little thing here, and you're like, this is what you need. And I was like, this is exactly what I've wanted and what I've been wanting for a doctor to say to me. Because I don't think that it's, I think the perception is changing. Women have come up to me since I've spoken to them, like in their 40s and 50s, and been like, you got a facelift at what age? I thought everyone does that when they're 40 or 50. And it's like, I think that, everyone should feel, if they want to, their most confident, best version of themselves. And I don't see a reason why you shouldn't do it when you're younger, when you have, you're going to have less like skin to pull back, and you're going to feel a better version of yourself younger. I don't see anything wrong with that. I think it's just the perception is changing.
Yeah, and it is. And that's the thing is, I don't think this is a like facelift for aging. This was a facial contouring procedure. And I think there's nomenclature that is lacking for what it is that we do for people. I have a 31-year-old patient that came in who, saw your kind of story and was just like, that's me. And she's 31. She's like, but I didn't age. I've been like this my whole life. And I don't like the way it looks. She's like, I look like a droopy dog.
Yeah.
And I want this taken care of. So it's not for aging. It's because she wants to be more beautiful. She wants to have a beautification procedure.
Yeah. And I would say that, like, I agree with that. I don't feel like my face changed that much from the time I was like 25 to like 35. Like, I did always have like sagging. I look back on photos like in my face, it was just like part of my facial structure. And like, I don't, when people see like my before and after pictures, I do not look like a different person. And I came to you also because I didn't want to look like a different person. I wanted to look like the best version of myself, like still like myself, but like sexier. in the easiest way to say.
Well, that's what I do. We both do that. That's kind of our shtick. We don't make people. I mean, there are people in Los Angeles that I think do very extreme looks. They make people look different. They go for it, and that's great. There are people who want that. That's not what we do. We take people from like, I don't like how this is going. It's going in the wrong direction. This is getting heavy through here. My face looks boxy. To let's make it heart-shaped. Let's make it look beautiful. Let's get your brow out of your eyelids. Let's get the lip to be shorter. So we did all that, and I addressed that at the consultation pretty clearly.
Yeah.
I don't mince words.
We did
Yeah, I think
everything. We did a lot.
I
My
think
neck.
that there is definitely an argument to be made for you can do this at a young age because you want to reshape or redefine how your face looks. But I also think that there is a component of aging to it, maybe not necessarily in your case, but there are people who are on the younger spectrum that have developed signs of aging. And just because they're in their 30s, it doesn't mean that they wouldn't benefit from a facelift. My view on this, if someone comes to me requesting or thinking about some kind of facial rejuvenation, is if the procedure will make you look better and their skin is lax or there's something that we can actually improve, then it's not about the age. So if someone comes to you and maybe they have some body dysmorphic disorder and they say, I want a facelift, and you kind of tug on their skin, like there's not anything that you can really do to improve them, then that's not the person that needs this procedure. But if there is a demonstrable benefit from doing one of these procedures, it doesn't really matter how old you are or even what the cause of why you're coming in to have this procedure.
Yeah, no, I completely agree with that. And I do think it's like, it was also kind of like a form of self-care for me.
Sure.
I felt awesome and confident in myself and my success in my career before I came to you. And now it just has enhanced that in so many ways. And I'm really, really happy.
And I love that you had that intro about how you had done the threads and the fillers. If anyone's listened to this podcast long enough, they know that I really don't love fillers. I think they have a time and a place, like certain areas, certain patients. But when you're doing it to sort of start addressing signs of aging or laxity of the skin, you can look strange. And if what you're actually going for is that natural look, like you mentioned, you just got to fix the problem. And fillers don't do that. They sort of camouflage it. So let's talk about the actual procedures that you had. And Dr. Calvert, maybe you can go through the menu.
Brow lift, upper
Blepharoplasty.
A blepharoplasty, fat transfer under my eyes.
Yes.
Deep plane facelift.
And the midface.
That's
right. We did the midface from the upper part.
Okay.
Yeah.
Lip lift.
Mm-hmm.
And my neck.
Yeah.
Yeah.
She's got it. That is a well-informed and consented patient.
That was it. The blepharoplasty was key because it's very subtle. But, again, this wasn't about you had gotten old. It was about let's make you look the best you can look. I always feel like facial aesthetic surgery is not about turning back the clock per se. I think it's about looking amazing. I think it's about looking your best. It's about looking great so that when people see you, they're just like, wow, you look, did you lose weight? did you get a new hairstyle? Like, what are you doing? Like, what are you doing for your skin?
I don't think you should be afraid to, like, if you want to enhance your face, to take the next step if you want to feel your most confident. I think that personally, like, the words that I live by is like, you only have one life, and I want to be like the most confident, like happiest version of myself. And I don't think anyone should stay away from that just to potentially like be worried about like judgment or what other people think. I I think it's just important to live and be your most truest self, and that's kind of what I am living by.
You know, doing this podcast, our whole purpose has been to educate people on what the reality is of doing these things, because, you know, we want people to have as much information as they can, get the best results they can. So your story is great, and it's fantastic that you've done so well. You do look amazing. I mean, you do. You look
Thank you so much.
you look fantastic.
Very happy.